Hello and welcome. So today's topic is our cornea. As I said, so it is actually transparent and almost watch glass like appearance. Basically it's a convex type structure, as you can see in this photo. Now, as I said in my earlier videos, that it forms the outer layer, mainly the fibrous coat of the eyeball. I mean the 1/6 portion of the outer layer. Now the measurements. Here you have to know about the anterior surface of this cornea. It's almost elliptical and the horizontal diameter is 11.7 millimeter and the vertically it's 11 millimeter. Posterior surface is almost circular and the average diameter is 11.5 millimeter. Thickness of this cornea ranges. In the center it is almost 0.5 to 0.6 millimeter and in the periphery it is 1 to 1.2 millimeter. Okay. Now this anterior surface of this cornea is very important, or the most important refractive structure, because its refractive index is 1.376 and the refraction power is 45 diopter. Now what is refraction? What is refraction power, refractive index? These things are basic part of the 11th or 12th standard physics. I will talk about these things later, not now. Now the microanatomy or the microscopy of this cornea. It has 6 layers. First of all, epithelium or epithelial layer. You're going to find that it is made of squamous, stratified, non-keratinized epithelium. Now it has 5 to 6 layers of epithelium. The lowermost layer you're going to find the basal cell or the basal cell layer. You're going to find here columnar cells. Then above 2 to 3 layers you're going to find umbrella cells. And the uppermost 2 layer you're going to find flat cells. Okay. After the epithelium, secondly you're going to find Bowman's membrane. It is made of condensed collagen fibrils, almost 12 micrometer thick. Now after the Bowman's membrane you're going to find stroma, which is also known as substantia propria. It is 0.5 millimeter thick and it is made by type 1 and type 5 collagen fibrils, which are intertwined by type 6 collagen fibrils. Now these filaments are embedded with some types of proteoglycans. Okay, so in these proteoglycans you're going to find chondroitin sulfate and keratin sulfate. Now what are these things? I will talk about details in biochemistry chapter, not here. Now fourthly you're going to find pre-Decemet's membrane. As you can see in this photo, it is also known as anterior elastic lamina. It is also known as Dua's layer. Now this name is due to, in 2013, Dr. Harminder Dua discovered this layer. That's why after his name we are also call it Dua's layer. It is almost 15 micrometer thick and it is resistant to air. I mean after this layer, air molecules cannot intervene or cannot pass through even via diffusion process. Okay. Fifthly, you're going to find Decemet's membrane. It is also known as posterior elastic lamina. It is thick and strong. It is resistant to the corrosive agents, chemical agents. Also, it is resistant to any kind of infections. It is also consists of collagens and glycoproteins, but it has a regeneration power. Okay. And lastly, or sixth point, you're going to find the endothelium. It is the innermost layer of the cornea and it is made by a single layer of flat hexagonal epithelial cells. The cell density is the highest. Here is almost 3000 cells in per millimeter square. Now the blood supply. As you know, this cornea is crystal clear transparent. Okay. So it has no vascular supply. I mean it has no lymphatic supply. It has no blood supply. And the nerve supply, it is done by the long ciliary nerve. See you in my next video. Till then, bye.